If you are confused about your cholesterol, or maybe you don't even know what those numbers mean, maybe I've never even had it tested, you're in the right place, because we've got one of the best in the business, Dr. Hassan El-Tamimi, Professor of Cardiovascular Medicine, Mohammed bin Rashid University of Medicine and Health Science, and the head of the Cardiology Department at Mediclinic Parkview Hospital, is here in the hot seat to help us out. So if you've got any questions about your health, maybe to do with your parents, risk factors, maybe you don't understand those numbers, reach out to us. You can be anonymous if you prefer. 4001 is the SMS. You've got the ARN Play app and the WhatsApp too. I know you're incredibly busy, Doctor, so thank you for making time to come in for a chat. How are you?
Thank you. Hi. Good afternoon. Thank you for the invitation. It's a pleasure to be here.
Now, I know this is very much your bread and butter, so I'm going to ask you to keep things as simple as possible for us, if that's okay. And we're going to start with the absolute basic. When we're saying cholesterol, what are we talking about?
Yes, I think it's a good base question. Cholesterol is a fatty substance that the body produces for biological reasons. Cholesterol is important for cell function, for hormones, and for multiple other things, particularly vitamins, vitamin D and all fat-soluble vitamins. Now, there is always a balance in the body. So people, yes, cholesterol is important, but like anything else, if it's over a certain limit, then it gives you the bad effect of it.
Okay.
Like sugar is good for you, but if you take too much, you'll be diabetic. And hopefully, because this is the equation with the social media is hitting, that you need cholesterol, yes, but when it's in excess, it sits on your arteries and create problems.
Now, can you explain good and bad cholesterol? What are we talking about there, Dr. Hassan?
Absolutely. I think, usually when you have done your lipid profile, you have certain numbers. So you have the total cholesterol, which includes three parameters. Your LDL, which is the bad cholesterol, and this is the one that blocks your arteries. The good cholesterol, the HDL, and this is good. It's a cholesterol, but its functionality is to take the bad cholesterol from your arteries and take it to the liver to get rid of.
So if you've got a good level of that, it means your body's functioning well, if the process is working.
Absolutely. And therefore, when you look at your total cholesterol, it may be high because your good cholesterol is high.
Okay.
And the last one is triglycerides. It's another component of the lipid profile. And it's important, but the main issue that we focus on when we treat our patients is LDL, because treatment has shown reducing LDL can reduce cardiovascular risk, strokes, and heart attack.
That's what I was going to ask you. If that bad number is high and is left untreated, what can the consequences of that cholesterol level be?
Absolutely. So when anybody does their lipid profile, and I think there are two issues I'd like to raise here. First of all, not everybody should have the same cholesterol or any of these parameters, because you need somebody who is 30 years old, no risk factors. Their cholesterol should be different from somebody who has just had a heart attack and had 2 stents.
So what we're talking about is that number cannot be viewed in isolation.
Absolutely.
There's context around it.
Absolutely. And that's for when you look at your lipid profile and you look at the range, this is misleading.
Okay. Right. Good question. Okay. So when we're talking about risk factors that you've just mentioned, what are some of the things we will need to kind of take into consideration to find out really which risk level or which risk group they're in?
Absolutely. So for me, in my clinic, every patient will get a risk assessment. And actually, it's available on the net. You have calculators, the Q-Risk, the UK one, the American, the European score. So we need to assess the risk factors. So that would include age, gender, total cholesterol, HDL, high blood pressure, and smoking.
What about genetic factors when it comes to cholesterol?
So yeah, I think genetics is key to, because, we talk about lifestyle changes, we talk about medication, but it's frustrating for people who do their utmost and still the number does not move. And this is where genetics kick in, and it's major.
I think for a lot of people there's a lot of confusion about the what next. You get that result and then you go, okay, well, do I go down the lifestyle route in terms of, how much control do I have over this? Using diet, using supplements, lifestyle factors, and when is medicine required?
Yeah.
So can we talk treatments and how you ultimately, as a cardiologist, really help decide a treatment plan for somebody?
Absolutely. I think we have a scale, and I need to raise the issue about our body's ability to clear cholesterol, and this is genetically determined. And how we clear cholesterol is through receptors on the liver cells. So you have a whole scale. People who have familial hypercholesterolemia, particularly the homozygote, they have no receptors. They get heart attacks at the age of 10. On the other side of the scale, you have people who can process cholesterol very effectively. This is all genetically controlled.
So I printed off my cholesterol results for you to have a little look at because I wanted an expert take. I had my lipid test done about a month ago.
Actually, I'm envious of your blood test.
So I gave Dr. Hassan. I was like, this number, I know my good cholesterol is very good, but is it too high? And you said,
No, but look at this. This is perfect. And your LDL is 37. And this is by all measure the lowest I've seen for a long time. So I don't know, what are you doing? And maybe you should advise your audience.
Maybe I have to say, I'm not doing anything special. Let me put it down to my healthy diet.
Then you have good genes.
Yeah, I think that probably is it.
Absolutely. Now, the other good thing is in red is your HDL, which is 92. This is unbelievable. And by the way, there's a village in northern Italy. They have HDL above 100, and their average age is 97. So that's a huge indicator. And as you can see, it's in the red. And the range,
that's what scared me. That's why I wanted to show it to you.
That's a good red.
Okay, fine. Maybe it's all the olive oil I have. Could that be a factor?
Absolutely.
We're going to be talking diet, lifestyle factors, supplements next. We've had a number of questions. For our expert of the hour, joining us live in the studio is the head of the Cardiology Department at Mediclinic Parkview Hospital. Dr. Hassan El-Tamimi is here. If you've got any questions for him, get in touch. You don't have to put your name on those messages if you'd rather not. Sharon wants to know about the difference between expensive and cheaper statins. I've also had a message here saying, is there any truth that eating grapefruit lowers cholesterol? We'll find out.
This content is for informational purposes only and does not intend to substitute professional medical advice, diagnosis or treatment.
It's your health clinic this afternoon, and joining us is the head of the Cardiology Department at Mediclinic Parkview. We've got Dr. Hassan El-Tamimi with us live, who's a professor of cardiovascular medicine, and on hand to take my questions and yours. And I wanted to come back to a couple of things you said earlier, Dr. Hassan. We were talking about risk factors and which risk group people fall into, and you mentioned gender, and I wondered why. What role does that play in terms of assessing cholesterol and risk factor?
Absolutely. I think this is key, because women are protected by their hormones, primarily progesterone, and therefore the risk of having a heart attack and stroke and whatever, and even if they have a bit of high cholesterol, we take our time because hormones play a major role. Unlike men, the moment you hit the 40, you are in big trouble.
Okay. And what about geography? You've worked in the US, the UK, here in Dubai, of course. What have you noticed in terms of prevalence?
I think this is a key question, and there is a disparity. Imagine people come in with heart attack in the Gulf area, and particularly in the UAE, around the age of 50, which is 15 years younger than their counterpart in Europe and the US. Why? Prevalence of major risk factors. Diabetes is a major issue. Actually, 1 in 5 Emiratis is diabetic. Hypertension, smoking, lack of exercise. So when we assess our patient, it's not about cholesterol or diabetes, it's a global issue. And the basic issue we treat is the blood vessels, the vasculature, because all these risk factors and all the treatment is to improve the health of your arteries, particularly your brain and your heart and the kidney.
If you've got any questions for Dr. Hassan, you're going to need to be quick. We're still away from Clinic at Parkview for just a few more minutes. Sharon's asking on the text line, what's the difference between expensive and cheaper statins? And do cheaper ones have more side effects? So let's talk treatment. What exactly are statins and what do they do when treating cholesterol?
So the body produces cholesterol via a chemical pathway where there is a formula where certain compounds in the body are transferred into cholesterol. So 2 ways to approach this. Either you block the synthesis of cholesterol or you facilitate its clearance. Now, statins block the synthesis. And therefore, sometimes you talk about the side effects, and it's primarily muscle, and this could be possible because you are preventing the synthesis of cholesterol. Now, statins work this way, and they've been around for 35 years. And they have shown over the years extreme effectiveness in reducing heart attack and stroke.
To come to Sharon's point, is there a difference between the expensive ones and the cheaper ones?
Frankly, you need to get it. I mean, certain parts of the world, they cannot afford certain. So there may be some differences in the chemical formula, but actually they are statins. So I don't feel there is a major difference there. We need to give it to patients.
And a question from Asma saying, "Hi doctor, is there any truth that eating grapefruit lowers bad cholesterol?"
It's grapefruit or apple cider or frankly. Actually, grapefruit, I don't like it in particular because it interferes with many medications. There is an enzyme called cytochrome P450. So, no.
Okay, I'll take a hard no, that's fine. Now, we've just been talking about, and I'm going to blow my own trumpet here, my excellent cholesterol. We're bringing in the girl from the naughty corner now. Producer Poonam's in the studio.
Can I just say the highest examination result I've ever received in my whole life from university, student studying, is my cholesterol levels.
She's scoring off the charts.
Off the charts. Tell me about it, doctor.
No, I want to hear your story first, Poonam. Before we get to your results, give us a little bit of background on how you've discovered that you've had high cholesterol and what's been going on.
So I've always been a complete sports freak, very active, ate really well. We didn't eat takeaways back home. We would eat at home healthy food. And then my brother, who's an optician, said to me several years ago, he looked in my eyes and he said, "You've got high cholesterol." I said, "How can you tell?" But obviously as opticians, they spot things. So I went to get a check and the doctor said, "It is off the charts. I don't know what you're doing." So then we think it's a genetic test. We tried that too. Then here, I did a CT calcium test, which I'd never heard of, and they said everything's clear, but they said because you're off the charts, you need to take statins. Now, I'm very holistic, so I tried homeopath. It did reduce it, but not enough. So here's my thing. If my CT calcium score is clear, do I need to take statins?
Well, I hate to compare your results with Helen's. So, sorry.
I know, I did really
Go
I did
on.
good, but I did bad.
But I tell you what, to have a total cholesterol above 300, that immediately puts you in the high risk.
I'm
I
a
don't
walking
think-
heart attack, aren't I?
Absolutely. I think you're lucky you have a brother who could see, because to get these external symptoms, that means your cholesterol immediately above 300. Now, this puts you immediately in the high-risk group. I think CT angio or CT calcium score does not do it for us, because you may not have, it may be normal, and it's looking at calcium, but you may have a plaque of 20-30%, which is insignificant, and it ruptures, leading to heart attack. So I think you being sporty and holistic helped you
Oh, wow, to
survive a
survive
heart
this
attack.
long.
Absolutely.
So what about doing a regular liver cleanse? Because that's where it comes from, the cholesterol. That doesn't make any difference with my levels.
No, because your body is unable to clear cholesterol.
And what
Pure
about side
simple.
effects of statins?
Well, I mean, I think, you have to try. If you get side effects, we will help. There are other possibilities to help. But in your situation, I am surprised you waited all this time.
And I'm still alive.
I'm glad you are, Poonam. So if Poonam came into your clinic at Parkview, doctor, what would you be advising? What would your treatment plan be for my producer that I really need to keep around, if you don't mind?
Yeah. So I think a key issue here is when you see a patient, what's their risk score? Are they low risk, medium risk, high, very high? And now we have a category of extremely high. And each category, you would have a particular LDL.
So which category am
So
I?
for you, I didn't even have to ask you whether you have hypertension or diabetes. You are a high risk.
Oh,
And that means your score is above 10%.
okay.
Now, which is manageable. So what we are going to do is to put you on a statin. I usually start with a sort of medium dose with this number. And of course, you're doing all the good things that you do to prevent.
But then that means I'm on statins for life, right?
Yes, of course. I mean, that's a question I get all the time.
Yeah.
Am I going to take it for the rest of the... Yes, I would like you to live longer and keep taking the medication.
Okay.
I want to squeeze in one last question, if you don't mind, Dr. Hassan. Poonam, you can go back to checking the travel and having a lie down in a dark room after that.
No, she's good. I think
Good.
we'll
She's
take care of
in
her.
safe hands.
Yeah.
For everyone listening today who's thinking or worrying, what would you love everyone today to do, to change, to adjust, to protect their heart health and ultimately keep that bad cholesterol down and boost the good one?
As Poonam was saying, we need to know your numbers. You need to know your cholesterol, sugar, blood pressure, because these are sometimes they could take forever to be symptomatic. So we do executive checkups. You deserve to have a checkup that will entail full blood test and then a stress test or whatever, and that really gives us 85% of risk stratifying you. And if there is any abnormality, we intervene early. We are in the business of prevention.
So you can't change what you can't measure. So you need to have that information. You need to know your risk factor. You need to know your score, because then you can start making changes.
Absolutely.
So information is power in this case.
Absolutely.
Okay. Message here saying Dr. Hassan has been a great guest. His explanations were so easy to understand. Thank you both. Dr. Hassan, if anyone wants to find you in real life, you are there, as I said, as the head of the Cardiology Department at Mediclinic Parkview. Are you okay if I share your website, your details with
Absolutely.
people?
And
Okay.
we run a very massive lipid clinic, and we will take care of everybody who has this problem.
If you need some reassurance, if we weren't able to get to your message today, or indeed you do want to seek Dr. Hassan's advice one-on-one in real life, send me the word doctor. I'll send you his details. Thank you so much for coming in. It's been an
Thank you.
absolute pleasure. I feel a lot more informed, and we'll get Poonam in clinic. She'll come
very
to your office next time. Dr. Hassan El-Tamimi, Professor of Cardiovascular Medicine and the head of the Cardiology Department at Mediclinic Parkview Hospital. As I said, if you want his details, send me the word doc and I will hook you up. It's just gone 2:30.
This content is for informational purposes only and does not intend to substitute professional medical advice, diagnosis, or treatment.